Hello, this is our Healthy People 2020 video. We were assigned the goal of nutrition and weight status. The purpose of this goal is to promote health and reduce chronic disease risk through the consumption of healthful diets and achievement and maintenance of healthy body weights. HealthyPeople.gov states that this goal is based on science, supporting the health benefits of eating a healthy diet and maintaining a healthy body weight. According to the CDC, in 2012, Louisiana reported 28.3 to 34.3% of their population to be obese. This is higher than Texas, who reported only 23.7 to 28.3% of their population. Although Texas had lower numbers of obesity at the time, Louisiana has put state policies in place to lower their numbers. These state policies and plans are factors that can impact achieving the goals within the state. The comparison between states does vary with each objective, however. The objective that I researched was to increase the proportion of schools that do not sell or offer calorically sweetened beverages to students. This includes soda pop or fruit drinks that are not 100% juice, sports drinks, and sweetened iced tea. These kinds of drinks have been shown to increase the risk of obesity and other health problems in school children. The 2006 baseline was 9.3% of schools, and the target for 2020 is 21.3%. The increase in schools who participate in this goal will increase the health of our communities.
I'm doing Healthy People 2020 on Nutrition and Weight Status, Objective 3. This objective is to increase the number of states that have state-level policies that incentivize food retail outlets to provide foods that are encouraged by the dietary guidelines for Americans. The goal for this objective is to promote health and reduce chronic disease risk through the consumption of healthful diets and achievement and maintenance of healthy body weights. About the data. The baseline from 2009 was 8, and the targeted goal for 2020 is 18. So the desired direction is to increase the desired. The targeted setting method is the projection/trending analysis. The numerator is the number of states who enacted state-level food retail policies. Comparable Healthy People 2010 objective is not applicable. The data collection frequency is biannual. The data source, the State Indicator Report on Fruits. The 2009 report provides information on fruit and vegetable consumption and policy and environmental support within each state. National and state-specific information is reported for behavioral indicators and policy and environmental indicators. This supply is from CDC. The date years available is 2009, and it's collected biannually. The selected content is that behavioral indicators include the consumption of recommended servings of fruits and vegetables. Policy and environmental indicators include indicators of the availability of healthier food in retail markets, schools, and food support systems. The methodology behind this is that the behavior indicators presented in this report are derived from objectives for fruit and vegetable consumption outlined in Healthy People 2010. Data are from the CDC's health surveillance systems. The policy and environmental indicators are from multiple data sources and measures several aspects of a state's ability to support fruit and vegetable consumption. Each indicator can be measured in most states. The report gathers data for policy for healthier food retail from 3 data sources. The first one is CDC Nutrition, Physical Activity and Obesity Legislative Database. The second one is National Conference of State Legislatures, Health Community Design and Access to Healthy Food Legislative Database. And the third one is the Food Trust. States are considered to have food retail policies that meet the criteria of this objective if their policies support at least one of the following objectives. Number 1, the building and or placement of new food retail outlets such as new supermarkets in underserved areas, loan financing programs for small businesses development, Number 2 is renovation and equipment upgrades of existing food retail outlets, such as purchasing refrigerators for small corner stores to allow for the sale of fresh product. And number 3 is the increase in promotion of foods encouraged by the 2009 Dietary Guidelines for Americans stocked or available at food retail outlets, such as increased display or shelf space of encouraged foods such as fruits and vegetables, assist in marketing of those healthier foods such as through point of decision information. This will affect the goals and objectives on a national levels by intake of low fruits and vegetables is a major risk for cardiovascular disease in the United States. Both mass media campaigns and economic incentives may increase fruits and vegetables consumption. Few data exist on this comparative effectiveness.
The objective that I will be discussing today is reducing the proportion of children aged 6 to 11 who are considered obese. The baseline is 17.4%. The target goal is 15.7%. Failing to achieve this goal would cause more cases of diabetes, type 2, heart disease, and high blood pressure. Achieving this goal would mean a decrease in the number of cases of diabetes, heart disease, and high blood pressure. There are two disparities concerning this group, which are sex and income. Disparities within this objective related to sex show that males have a rate of 17.6%, while females had a rate of 17.5% of obesity. Disparities concerning income was 25% for low income and increased less than 10% for families of high income of obesity. When compared to Texas, childhood obesity between 6 to 11 was 33.3% compared to Louisiana 34%. To help combat the obesity rate, both states offer school nutrition standards and physical education. In addition to these strategies, Texas offers personnel management and food service where Louisiana does not.
Hi, my name is Charlette Crawford, and the objective that I researched was reducing the proportion of children aged 2 to 5 years who are considered obese. Achieving this goal will cause childhood obesity to be at an all-time low, provide families and communities with preventive methods to prevent further generations from struggling with childhood obesity, and promote healthier lifestyles. Failing to achieve this goal will cause a continuation of an already booming problem and promote experts and community helpers to join together to develop solutions to improve childhood nutrition and health regimens. When speaking of obesity, it is often defined as excess body weight adjusted for height as measured by BMI or age and sex-specific BMI percentiles for children and adolescents. Children and adolescents who are considered obese have a BMI at or above the sex and age specific 95th percentile based on the 2000 CDC growth charts. Disparities within this objective related to sex show that the better group rate was 8.4% and was attained by girls. The worst was 12% and it was attained by boys. The data shows that the absolute difference between the best and the worst was 3.6 percentage points. Other disparities related to this objective are related to race and ethnic background as well as income. Disparities related to race and ethnic background show the best group rate of 6.4% being attained by white non-Hispanics, the worst group rate of 15.7% being attained by Mexican Americans. The absolute difference between these two groups was 9.3%. Average for all race and ethnic backgrounds was 15.2%. Disparities related to the income show the best group rate of 11% was attained by families whose incomes were between 200 to 399% of the poverty threshold. The worst 12.3% by family incomes that were less than 100% of the poverty threshold. The absolute difference of the two groups was 1.3%. The baseline goal related to the objective is 10.4%. The target is 9.4% for 2020. When compared to the state of Texas, the childhood obesity rates for children ages 2 to 4 is 14.9%. This is higher than the state of Louisiana and shows that the state of Louisiana is closer to achieving their goals, but the state of Texas has implemented more initiatives and programs, such as promoting breastfeeding for at least the first 6 months for infants, revised nutrition programs for early childhood programs in schools, increased physical activities such as a state-mandated recess and PE programs, as well as promoting drinking more water statewide. Though Louisiana is closer to reaching their goal than Texas, Texas has more programs in place to decrease childhood obesity.
My name is Nancy. I'm going to talk to y'all about the Healthy People 2020 goal, Nutrition Weight Status 2.2. It's to increase the proportion of school districts that require schools to make fruits or vegetables available whenever other foods is offered or sold at schools. Data for the objective is the baseline is 6.6% of school districts require schools to make fruits or vegetables available whenever other foods are offered or served in 2006. So the baseline for 2006 was 6.6%. The 2020 target is 18.6%. The desired direction is for it to increase. The target setting method is to maintain consistency with national programs, regulations, policies, and laws. The numerator, number of school districts who require that schools make fruits or vegetables available to students whenever other food is offered or sold. The denominator is number of school districts. The desired direction is increased desired. Data collection is frequency is periodic. Questions used to obtain the national baseline data from the 2006 School Health Policies and Program Study Food Service District Questionnaire. That's where they got their information. The questions that they asked, where they got their information. The questions that they asked was, does your district require or recommend that schools make fruits or vegetables available to students whenever other foods is offered or sold, for example at school parties or in school stores? They had 3 options to choose from, which was require, recommend, or neither. The methodology was, starting with the 2012 survey, the name of the SHPPS survey was changed from the School Health Policies and Program Study to the School Health Policies and Program Study to the School Health Policies and Practices Study. A school district is considered to meet the criteria for this objective if the response to the cited question is required. So in 2006 it was 6.6 was the baseline. In Louisiana, it was not required or recommended to offer 3 types of milk during breakfast. It was required to offer 3 or more types of milk during lunch. It was not required. Louisiana was not required or recommended to offer 2 or more fruits or types of 100% fruit juice. And in Louisiana, recommended 2 or more different entrees or main courses. It also recommended 2 or more non-fried vegetables. In Texas in 2006, it was not recommended 3 or more different types of milk. It was required 3 or more different types of milk for lunch. It does not require or recommend 2 or more different fruits or 100% fruit juice, or recommend 2 or more different entrees or main courses. And in 2006, Texas did not require or recommend 2 or more different non-fried vegetables. So in 2012, it went up to 9.6. So it is my determination that we will meet the 2020 goal by 2020.